Are you considering Prozac but feeling overwhelmed with all the questions? You're probably thinking, will this medication really help me? What if it makes me feel worse? How long will it take to see improvements? What kind of side effects will it cause? You may also worry about addiction to this medication or withdrawals if you stop taking it. My name is Dr. Air, board certified lifestyle psychiatrist. Let's discuss the top 5 things you need to know about Prozac. Number 1, what is Prozac and how does it work? Prozac is an antidepressant that belongs to the class of medications known as SSRIs, selective serotonin reuptake inhibitor. The chemical name is Fluoxetine and it works by increasing a brain chemical called serotonin. Prozac is approved for the treatment of major depressive disorder, obsessive compulsive disorder, bulimia, panic disorder, and premenstrual dysphoric disorder, PMDD. In combination with olanzapine, it is also approved for bipolar depression and treatment-resistant depression. Prozac works like a thermostat in your brain, adjusting it to the right temperature and helping to control your symptoms. Number 2, how long does it take to work? Well, imagine your mind as a beautiful but overgrown garden. Flowers represent your positive thoughts and emotions, and weeds represent anxiety and depression. Prozac acts like a skilled gardener, trimming away the overgrown weeds. This takes some time. So most people begin to feel better within 2 to 4 weeks. For some others, it may take as long as 6 weeks. This means you need to be patient and give it time to work. When fluoxetine begins to take effect, typically you'll notice your mood lift. You may also feel more energetic. Your appetite, sleep, and concentration may also improve. So on to number 3. What are the side effects? Well, like Tylenol, aspirin, and all other medications, there are side effects. Fluoxetine is no exception. It does not mean you will definitely develop side effects. Everyone is different. Many people experience no side effects with this medication. For some others, adjusting to Prozac can be like getting used to a new pair of shoes. It might be uncomfortable initially, but you'll feel better with time. Of course, some side effects may be so severe that you have to stop the medication. This is one of the reasons why we have the start low and go slow approach with antidepressants. We start at a low dose and only gradually increase the dose over several weeks as needed. The common side effects of fluoxetine include stomach discomfort with possible nausea, diarrhea, or constipation, also headaches, agitation, anxiety, difficulty sleeping, and dry mouth can occur. Other side effects include dizziness, sweating, abnormal dreams, and also sexual side effects. These sexual side effects can be low sex drive, difficulty having an orgasm, or erectile dysfunction. Note, however, that these sexual side effects can also be symptoms of depression. On a positive note, though, many of the side effects of Prozac tend to go away within 5 to 7 days. So as long as the side effects are not severe, your doctor will usually have you wait about a week or so. Always consult your doctor if you experience any side effects with any medications. Number 4, interactions with other medications. Your liver has enzymes called cytochrome P450. Prozac inhibits these enzymes, which can lead to increased blood levels of some drugs that get broken down by these enzymes. This can lead to toxicity if the medications are not adjusted. So please let your doctor know what medications you're taking before you start fluoxetine. Also, fluoxetine has a long half-life and an active byproduct called norfluoxetine. These prolong the inhibitory effects on cytochrome P450 enzymes, meaning drug interactions can persist even after stopping it. Fluoxetine can also cause serotonin syndrome, a condition that results from excessive serotonin in the brain. This happens when fluoxetine is combined with other drugs that increase serotonin in the brain. Examples of such drugs include other antidepressants like SSRIs, SNRIs, and MAOIs. Other medications and illicit drugs can also precipitate serotonin syndrome. Symptoms of this condition include tremors, increased pulse rate, fever, muscle stiffness, confusion, and seizures. Now, on to the final one, number 5. Is Prozac addicting? A patient once told me taking Prozac felt like switching from an old black and white TV to a colored one. She talked about how her life was so much brighter and more manageable, but she worried about getting addicted to the medication. Antidepressant medications are not addicting. You do not get addicted to Prozac. However, because your body is used to the medication and the level of serotonin buildup caused by this medication, you don't want to stop cold turkey because stopping antidepressants abruptly can cause withdrawals. So never stop any antidepressant abruptly. Always discuss with your doctor. It is important to note, though, that withdrawal is not as common with fluoxetine as compared to, say, Zoloft or Lexapro. This is because fluoxetine has a long half-life, meaning it stays in your body longer. This means it slowly tapers itself out of your system when you stop. Antidepressants are beneficial, but it is not only about medications. There are 3 nutrients to consider optimizing if you struggle with your mental health. Check out this next video to find out.